Hi everybody. Today we're going to talk about what makes up a reliable pharmacogenetic test. These are the tests that you might order for a patient if you're a provider, that you as a patient might have a provider order for you in some clinic. So what makes up a reliable pharmacogenetic test? So really what we need to ask is, what makes up a pharmacogenetic test itself? And it is actually three components really that makes up a pharmacogenetic test. First, the gene-drug pair. So what is the gene you're looking at along with the drug that's being used in a given scenario? And what is their connection? What is the evidence behind them? The gene-drug pair. Second, the lab. So what lab are you ordering your pharmacogenetic test from, and what qualities should this lab have that you can know that your pharmacogenetic test is reliable? And third, how are the test results, or how is the test result reported? And so often this is also called a DST, or decision support tool. And so we'll talk a little bit about decision support tools at the end of this video, and also I'll have another video on decision support tools. So what is the overall goal here of these three components that make up a pharmacogenetic test? And that goal is to have both analytical and clinical validity. So if you look at these three components, you can see that your clinical validity is most likely going to come from number 1. Your analytical validity is going to come from number 2. And the report could have a little bit of both, analytical and clinical validity, but probably mostly clinical validity. So let's walk through each of these three to know how we are going to have a reliable pharmacogenetic test. So first, let's start with gene-drug pair. How do we choose a gene-drug pair that's going to be reliable and have good clinical validity for our given scenario? And what you're going to want to do is you're going to want to query the databases, query the evidence to find the highest level or best evidence gene-drug pair for a given scenario. Because, as you might surmise, or you may or may not know, a lot of pharmacogenetic correlations out there aren't very high-level evidence. So we want to make sure we're using high-level evidence gene-drug pairs in treatment, in using part of the clinical toolbox for pharmacy or pharmacotherapeutic treatment. So where can you find these best evidence gene-drug pairs? Now, there are several databases out here, but the one I'm going to promote here is called pharmgkb, or the Pharmacogenomics Knowledge Base. Now, the reason I support this one, or at least the reason I promote this one, is because it's professionally curated, it's supported by NIH, and so it's regularly updated, new evidence is put into the system, and it's frankly very easy to use. So you can look up different genes, you can look up drugs, you can look up other types of mechanisms. So it's very useful. So you can go right to the pharmgkb website and you can begin to do searches right away. Additionally, the reason that I promote pharmgkb is because it includes the CPIC guidelines right within their database searching as well. And CPIC stands for the Clinical Pharmacogenomic Implementation Consortium. And so from the title you can tell it's a group of experts that get together that determine when a gene-drug pair has enough reliable and robust evidence, so enough high-level evidence, where you can actually create a guideline from it. And so these are called CPIC guidelines. And so they're put out as papers where you can go freely read the papers. You can see their treatment algorithms within the papers depending on the gene in question and the drug pair. And so pharmgkb will automatically link to those when you search a given gene or drug if it has a guideline. So it's a really nice website that allows you to look up the level of evidence and to quickly find CPIC guidelines that are available. So this will lead you to a nicely reliable gene-drug pair when you're figuring out how to order a reliable pharmacogenetic test. Now, after you've figured out your highly reliable or guideline available gene-drug pair, you need to figure out where is the lab that you're going to order it. Lab. So how do you find a reliable lab? Because remember, here we're looking for that technical validity for the pharmacogenetic test. And so with all labs that we do testing in healthcare, we're looking for an accredited lab. So accreditation is really important, especially when it comes to pharmacogenetic testing, because these can be highly complex tests that involve things like sequencing or PCR reactions. So you want to find an accredited lab for that specific gene-drug pair. And what does that accreditation look like? It looks like it comes in the form of CLIA and or CAP certification. And so what does CLIA stand for? CLIA stands for the Clinical Laboratory Improvement Amendment, which was passed by CMS, and then CAP stands for the College of American Pathologists. And so essentially what these are certifications that ensure robust industry standards for the testing of human samples. Now, it doesn't even have to just be genetics. CLIA CAP certification applies to many, many different tests, but you specifically want to make sure that your lab has it for your pharmacogenetic test. That will make sure you have your technical validity, and you can know that the result you're being given is highly likely to be that result, that true result. Now, where can you find out if a lab is accredited? Well, you could call and ask. You can ask if they do that gene-drug pair. Additionally, there's something called the NIH Genetic Test Registry. However, this may not be a complete and comprehensive test registry, but it is searchable. You can go search that. Additionally, CLIA and CAP certifications are searchable online as well if you wanted to go look up a specific lab's latest CLIA cert, when it expires, and all that good stuff. So far we've talked about how you find a clinically reliable gene-drug pair, how you find that a robust and technically reliable lab. Now finally, let's move on to our third component of a reliable pharmacogenetic test. And that third component is the report. So how does the lab give you the genetic results for that patient? And often, many, especially on the provider side, but even on patients as well, want that report digested and summarized in a decision support tool. So very often decision support tools will come with a commercial company because that is how they're advertising their product to you. But you have to be careful because not many of them are clinically validated in the literature, meaning we don't know if that really helps with the treatment to put it into a decision support tool. However, it is useful to call a lab and understand how they're going to give you the results, if they're going to have a decision support tool. If you're in a hospital system, usually that'll come in the EMR. And so these are the good questions that you'll want to ask, and we'll go over decision support tools in a future video. So if you pick a pharmacogenetic test by looking at the gene-drug pair, finding highest level possible evidence, by picking a lab that's accredited, and understanding how the lab gives you the report, or if there's a decision support tool, you will be able to find a reliable pharmacogenetic test. Thank you for your attention.